The NHS. This is really quite an extraordinary story. Thousands of people are waiting more than 90 days, 3 months between mental health appointments. This is across England, according to the latest figures. Now, in terms of therapy, this is talking and treating patients for things like stress, anxiety and depression. Now, when you look at the figures, in the year to November 2022, some 680,000 patients had a second appointment across England, but 22% of these had to wait more than that, 90 days, to see, to get their second appointment. And that seems to me an extraordinarily lengthy amount of time to wait. And of course, the Royal College of Psychiatrists saying that this puts patients' well-being at risk. Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public, joins me now. Good morning.
Good morning, hi.
Obviously as a doctor, I'm pretty traumatised by seeing this. I mean, certainly we're getting people there, they're having their first mental health appointment, but waiting 3 months to have a follow-up appointment simply isn't good enough.
Well, it's really sad, it's terrible, and it's actually covering up the reality of the shortage of mental health services. I think the starting point is that the need to admit how deep the crisis is in the NHS, how long-lasting it is, and that it's the result of government policy over the last 12 years now. When the access to mental health services is so terrible, and I used to be an NHS doctor as well, by the way. I was a paediatrician working in a multidisciplinary centre where children access mental health needs as well as disability services. And what's happening is that there's a disguising of the pressure on mental health services and indeed on other parts of the health service by speeding up access to the first appointment, which is actually often an assessment period where the NHS staff get to know the nature of and the severity of the service, but then the follow-up service is actually put on hold. So in reality, there's a second hidden waiting list. And if the government and the NHS senior managers disguise that fact and hide behind the numbers of people being seen more quickly for a first appointment, they are actually deceiving the public and they're not serving the needs of people in mental health crisis.
So it's a fiddle, because the National Institute for Health and Clinical Care Excellence states that 75% of patients should get a first treatment within 6 weeks. So essentially they are getting that, but as you say, the second one doesn't follow. What does that do to the trust in the system? We're leaving vulnerable patients sitting there without any follow-up. They may have initiated treatment and they're left without anyone telling them what to do next.
Well, it means that NHS patients are let down, and the most severe circumstances are that people die on that waiting list. We know that the other part of the news overnight is the confirmation that A&E waits are in meltdown in many parts of the country, not all, but many parts of the country. And I'm sure you know this as a doctor, but there's 500 people avoidably dying on waiting lists in the acute pathway from being acutely ill in their home to getting to hospital and having definitive treatment. And that includes people in mental health crisis. So the overall situation is very, very dangerous, but it's also dangerous for the staff. And I worked in the multidisciplinary team, and I've seen mental health staff in tears because they know that they are not able to meet the needs of the children and families. And in the worst case scenario, children have even died on that waiting list, committing suicide. So the secondary wait for definitive treatment and ongoing support is the crucial hidden factor in access to mental health support. I think that it's essential that the government admits the NHS is in crisis, and that the policies that they have pursued, the deliberate underfunding of the NHS for 12 years.
Well, it hasn't been underfunded. 176.
Yes, it has.
Well, I don't think it has. 176 billion goes in, another 36 billion on top. The money isn't reaching the clinical services. It's not about the money going in.
You're just naming a figure, but
those are the figures.
Well, it's not. You're missing out the context, David. For example, let us compare France and Germany with ourselves. And there's a trope that the NHS is a bottomless pit, that the money goes into a deep hole and is never seen again. There's no doubt that if NHS money was spent solely on public services, and not, for example, £37 billion on private contracts for PPE, then you'd get better value for your money. But if we were in Germany, pro rata, there'd be between 40 and 70 billion pounds a year extra spent every single year on the NHS, and 40 billion in France. So it is not true that the NHS is the most expensive waste of money. It's actually, when it was well funded, it was the most efficient health service in the world.
Let me just bring you back, if I may, to A&E waiting times, and you mentioned those, but they are really shocking as well. More than half of patients have had to wait more than 4 hours. I also think this is a fiddle, and I know this. I used to work in A&E, because, of course, they count the time it's taken for you to be triaged. Now, of course, it means that then you can wait. What is interesting about these statistics is that the ones who have done very well, let me just name the ones that are particularly bad. Hull, Wye Valley, Shrewsbury and Telford were the worst for A&E waits. When you look at the better ones, Northumbria, for example, they run as a different system. This is an integrated trust. Do you think the changes that were implemented fairly recently, actually, moving, obviously, from the integrated care systems, or moving to those from the CCGs, has any of that change and those transformations, has that helped, do you think?
I think the changes have been managerial and finance-based rather than delivery of care to patients. I think that good health service staff and good social care service staff will always want to work together to the best effect. But actually, what's destroying the system at the moment is the disintegration of the NHS and the failure to fund the kind of multidisciplinary cooperation that is needed to deliver safe care to patients. So the latest changes have divided the NHS up into 42 sort of semi-autonomous pots of NHS care, where the priority is to balance the books. And it has not ended the disintegration due to fragmentation of private contracting. It's actually facilitating the inroads into the NHS of private care. So I think if there was a political change of will to return to the priority of public servants delivering their expertise in cooperation with other parts